Hello dreamers, in this snapshot video we are going to talk about important image-based questions in psychiatry. So let us begin. The first question is a 35-year-old female is brought with symptoms of low mood, decreased interest, decreased appetite, low energy, guilt since 6 months. And the following image depict a sign seen in the patient. Which of the following is correctly matched? So the options are A. Omega sign in depression, B. Varigat fold in depression, C. Omega sign in mania, and D. Varigat fold in mania. So now if you see in the image, the patient is having some sign on the forehead. If you look carefully, what is this sign? This sign is known as omega sign. So what is omega sign? It's a omega shaped fold which is seen on the forehead above the root of the nose as seen in the image, and it occurs because of excessive use of the corrugator muscle. Now, this can be seen in patients with depression. So in depression, there are some physical signs which may be seen, especially in patients who have chronic depression or recurrent depression, we can see some of these signs. So, and also in the question, if we see the history, the patient is having symptoms of depression. So the correct answer is that the patient is having omega sign in depression. Another physical sign which can be seen in depression is the Varigat's fold. So if you see in the image, so there is a triangular fold. There is a triangular fold in the nasal corner of the upper eyelid. And this occurs because of changes in the tone of the corrugator as well as the zygomatic facial muscles. Again, this can be seen in depression. So two important physical signs which may be seen in depression is the omega sign and Varigat fold. Now, let's talk about this next question. A 20-year-old male patient brought to the emergency with symptoms of decreased speaking, there is decreased oral intake, is repeating words spoken in front of him. The image depicts a sign seen in the patient. Which of the following is the treatment for this patient? So first we need to identify what the patient is suffering from. So as you can see, the patient is speaking less, patient is repeating words which are spoken in front of him. So what is this phenomenon? This is echolalia. Okay, so if you ask the patient what is your name, the patient again says what is your name. He is repeating the words after the people around him. Okay, and if you see in the image, the patient is maintaining a odd posture. So again, this symptom could be catalepsy or posturing, which is maintaining of odd posture for the long time. So if you have to differentiate whether it is catalepsy or posturing, how we will differentiate? We need to know that catalepsy is a passive phenomena. So that means if someone made this patient come into this posture and then this patient is maintaining this posture, by himself for a long time, then it is catalepsy. And suppose this patient came into this posture on his own and now he is maintaining, then it is posturing. So this is again, all these symptoms are telling us that the patient is having catatonic symptoms, okay, which can be seen in various conditions like mood disorders, schizophrenia, and various other conditions. So let us enumerate some of the catatonic symptoms like stupor, excitement, mutism, then waxy-flexibility, there is negativism, automatic obedience, echolalia, which is seen in the patient, and echopraxia, then mannerisms, stereotypies, there is grimacing and ambitendency. So these are some of the catatonic symptoms. When we talk about the treatment of catatonic symptoms, we give lorazepam. So initially parenterally as IV lorazepam or IM lorazepam, and ECT is also one of the modalities of treatment. So if we come back to the question, so the options for treatment is A. haloperidol, B. lorazepam, C. sertraline, and D. olanzapine. A. haloperidol and olanzapine are antipsychotics. Sertraline is a SSRI, it's an antidepressant. So the correct answer is the patient is having catatonic symptom and the treatment is B. lorazepam. Now coming to the next question, a 19-year-old female is brought in the clinic by her mother with complaints of some unusual eating patterns for 2 years. She eats large amount of food when she is alone and then purges out food after eating. Now on examination, she presents with increased body weight and her dental condition is poor. Her hands have some lesions as shown in the image below. Which of the following is correctly matched? So if you see the image, there are some injuries, some callus formation on the knuckles. So let's see the options. A. anorexia nervosa, omega sign. B. anorexia nervosa, Russell sign. C. bulimia nervosa, omega sign. And D. bulimia nervosa, Russell sign. So let us try to understand what is this sign, this injury or this callus on the knuckles. What is this known as? This is known as Russell sign. And this occurs because of repeated purging such as self-induced vomiting. So because of repeated self-induced vomiting, these knuckles get injured by the teeth and the area, okay, and by the oral area. So there is callus on the knuckles. So it's a feature of purging. Now it can be seen in bulimia nervosa, where there are episodes of binge eating followed by compensatory mechanisms like purging, as in this case. And also it can be seen in anorexia nervosa. As we know, in anorexia nervosa there are two types of subtype. One is restrictive type and the other is binge eating purging. So in that binge eating purging subtype of anorexia nervosa also we can find this Russell sign, because it is due to the self-induced vomiting. It is occurring because of this. So this can also be seen in anorexia nervosa. Now coming back to the question, if you see this question, so this patient is having episodes of eating, binge eating followed by purging, and also look at the body weight. There is increased body weight. So again, all these are telling us that it's a case of bulimia nervosa, and we have already identified the sign. The sign is Russell sign. So the correct answer is option D. Now let's talk about the next question. Which of the following is not an indication for the procedure shown below? So there is a procedure which they've shown in the image. Now the options are A, catatonic schizophrenia, B, severe depression with psychosis, C, mild depression, and D, mania not responsive to medication. If you see, the patient is lying unconscious under anesthesia and there are bilateral electrodes have been placed. So what is this phenomena? What is this procedure which is being done? It is electroconvulsive therapy, or ECT. So basically electric current is passed through the electrodes and it is producing a convulsion or a seizure. Okay. So it is ECT. And what type of ECT? So it is modified ECT or indirect ECT. Nowadays we don't use direct ECT. So what is modified ECT? When the ECT is administered after giving anesthetic agent and muscle relaxant, as shown in the image. So let us understand some of the indications of ECT. So in major depressive disorder, ECT can be given in conditions such as when there is depression with suicidal risk. In fact, it is the treatment of choice when there is suicidal risk. It can also be used when there is depression with stupor, or there is severe agitation, or when there is depression with psychotic symptoms. And also if the patient who have failed medication trial, you've given medication but there is not much response, or who are not tolerant to the medication, then also we can consider ECT. In manic episode, we can give ECT when the person is unresponsive or intolerant to medication. It can also be given when the manic behavior has produced dangerous levels of exhaustion. Then also we can consider ECT. In schizophrenia, catatonic schizophrenia is one of the indications of ECT, and also patients who are not responsive to or intolerant to medication, then also we can consider ECT. Then there are various other indications where ECT may be found to be useful, like OCD, neuroleptic malignant syndrome. In neurology, conditions like intractable seizure disorder, hypopituitarism, on and off phenomena of Parkinson's disease. These are some of the indications of ECT. So if we go back to the question, so in which of the following ECT is not indicative? So yes, we can give in catatonic schizophrenia, severe depression with psychosis, we can give in D, mania not responsive to medication, then also in mild depression, generally it is not indicated. So the right answer is C. Let's talk about this next question. The following technique shown below is used for which of the following? So if you see, there is a procedure or a technique has been shown, and as you can see, when the injection is being given at 90-degree angle, there is someone is pulling the skin. So there is pulling of the skin here. Okay. So what is this technique, or in which condition generally we use this technique? So the options are for monitoring carbamazepine therapy, B, administration of antipsychotic depot, C, administration of nicotine patches, and D, monitoring of lithium therapy. So basically, what is this technique? This technique is known as Z-track technique. So what we are doing is, when the medicine is given through injectable form, so we are pulling the skin, and what is happening? So as the medicine reaches the muscle, okay, so as the medicine, we inject the medicine, and then when we are pulling out the injection, we leave the skin. So what happens? There is a Z-track. There is a Z-track which is formed. Okay, there is a Z-track which forms. So what is the advantage of this Z-track technique? Is it basically prevents the tracking or leaking of the drugs from the muscles to the other tissue, because had it been a perpendicular track, then it would have oozed out. The medication would have oozed out. But because of this Z track, now the medication will not ooze out to these surrounding tissues. So this is known as Z track technique. And where do we use this Z track technique? To give long-acting injectables antipsychotic or the depot antipsychotics. Okay. Now let us discuss some of the medications which are available as depot preparations. So first generation as well as second generation antipsychotics. Some of these medications are available, which you can remember with the mnemonic. For first generation antipsychotic, Fizzy PH. So what are these medications in the first generation? These include flupentixol, fluphenazine, zuclopentixol, pipotiazine, and haloperidol. While in the second generation antipsychotics, the medications which are available, you can remember with the mnemonic PARO, that is paliperidone, aripiprazole, risperidone, and olanzapine. So these are some of the medications which are available as depot antipsychotics. So the correct answer is B. It is used, this technique, Z-track technique, is used for administration of antipsychotic depot. Now let's come to the next question. A psychiatry resident is showing image to a patient which is given below. Which of the following test is being performed on the patient? So there is an image. As you can see, it seems to be a symmetrical image. So bilaterally symmetrical image you can see, okay, like an ink blot, okay, as if somebody has put ink and then folded the paper, and if you see, there are again symmetrical image has been shown. So the options are A, intelligence assessment, B, personality test, C, cognitive test, D, visual motor test. So basically this is Rorschach ink blot test, which is one of the tests used for personality assessment. So the correct answer is option B, personality test. So it's a Rorschach ink blot test. So it was developed by Hermann Rorschach, so it's named after him, and it is one of the most frequently used projective personality test. And it consists of 10 ink blot cards as one of the cards we have seen. And as you can see, it's a very vague, very ambiguous, kind of card. As if you try to see, there is nothing specific shown. If you try to see what is there, you may have different responses from different people. So there is a vague or ambiguous stimulus, and it is symmetrical. And patient is asked that what he sees in the cards, and subsequently whatever the answer the patient gives, that answer is then used to understand the unconscious mind of the patient. So this is the basics of the personality or of the projective personality test. So basically these projective tests are used, as the principle is that the patient projects his internal conflicts or his inner wishes or desires on the test, and based on the answers, patient's personality is assessed. Okay, so this is one of the projective personality test. Now the next question, again, identify the test in the image below. So there is an image shown and you have to identify the test. So the options are A, Rorschach test, B, thematic apperception test, C, Bender Gestalt test, and D, sentence completion test. So again, it is one of the projective tests, and in this case the image which is shown is a part of a test known as option B, that is thematic apperception test or TAT test. So this is thematic apperception test, TAT. Now basically what is done in TAT, it consists of 20 pictures which depict individuals involved in a variety of activities. So as you can see in this image, so there are some individuals and they are engaged in some activities, and what the person is asked is to make stories about them. Okay, and again it is a projective personality test. So whatever story the person makes after seeing these cards, again it depicts the patient's internal or unconscious conflicts or desires. So we try to understand. Again, these are projective tests, these are subjective tests which we use in assessment of personality and for psychodiagnostic uses. Next question is, EEG finding of a sleep state is depicted in the image below. Which of the following is not true about the sleep state? So one of the sleep states EEG findings are given. Okay, now options are A, EEG has sleep spindles and K complexes, B, maximum time spent in this state, C, it is first stage of sleep, and D, eye movements are slow. So let us try to understand what is this. So if we in the sleep we have two types of two phases of sleep. One is NREM and the other is REM. NREM is again further divided into N1, N2 and N3. Now, if you look at N2 stage, the EEG findings of N2, you can remember N2. So there are two important EEG findings. One is that there are sleep spindles, sleep spindles are burst of activities of around 12 to 14 hertz. And there are K complexes. So what are K complexes? These are again sharp negative waves followed by positive waves. So if you see the image which is shown, again it is depicting that there are sleep spindles, there are sleep spindle burst of activity, and then there are K complexes seen. So it is basically N2. Okay. Now in N2, if we see the EOG, now as the name suggests, NREM, what is NREM? It is non-rapid eye movement. So how will be the eye movement? So EOG will basically tell you the eye movements, electro-oculogram. So eye movements are generally minimal or they are none. And EMG, electromyogram, there are low tonic activity can be seen in the EMG of N2. Also, in N2 stage, we spend around 45% of the total duration of sleep. So N2 stage is a stage wherein we spend maximum time during the sleep. So if we see the options, now EEG, this EEG has sleep spindles and K complexes. This option is correct. Maximum time spent in this sleep state is again correct. It is the first stage of sleep. So first stage of sleep. So after, if the person falls to sleep, the first stage which the person encounters is N1 and then it is N2. So no, this is not the first stage. Again, eye movements are slow. Yes, it is NREM. So non-rapid eye movements. Again, this is correct. So the correct answer is option C, that it is the first stage. No, it is not the first stage. Okay. Let's come to the next question. Identify the highlighted stage of sleep in the image below. So we have EEG finding, EMG and EOG findings of a sleep state, and we have to identify what is this sleep state. So we have options. Option A is N1, option B is N2, option C is N3, and option D is REM. Okay. So let's try to understand this. So if you see this highlighted, image. So here, if you see the EEG finding, you will see that there are again fast activities there, and it appears to be sawtooth appearance. So it is showing sawtooth appearance, and also beta alpha activity like activities are seen. Now if you look at the EMG, again EMG's finding is showing very minimal activity. Okay, minimal or very negligible activity. And if we see the EOG, again EOG is showing fast activity. Okay, so EOG is fast, EMG is minimal, and the EEG is showing activities like beta and alpha wave but sawtooth appearance. So what is this stage? This is nothing but REM. So in REM, again we know that the EEG shows beta alpha activities with sawtooth appearance. Okay, it is rapid eye movement, so EOG will be fast, and EMG, so muscles are in a state of paralysis. So EMG very negligible or no activity. So this highlighted area is the REM stage. Now if we look at the other stage, if you see that there are slow waves, you can see here, slow waves you can see. And if you see the EMG, yes, you can appreciate the muscle movements, muscle activities there. And if we see the EOG in this stage, it is slow. So what is this? What is this stage? This is nothing but N3. Okay, so this is REM, this is N3. And if you see the EOG, the EEG is again, it is showing fast activity, probably beta alpha activities there. EMG, again EMG muscle movements are again present, and also ocular movements are also present. So this is basically the findings of awake state. Okay, so we've discussed all these in the image. So if we go back to the question, so the correct answer of this highlighted area is option D, that is REM. Now let's talk about the next question. Which of the following treatment modality has been depicted in the image below? So the person is sitting comfortably, eyes are open, and there is a probe which is put on the head. So the options are ECT, option B is VNS, that is vagus nerve stimulation, option C is RTMS, that is repetitive transcranial magnetic stimulation, and option D, that is deep brain stimulation. Okay, so the correct answer is, it is option C, this is RTMS. This is repetitive transcranial magnetic stimulation. So what is transcranial magnetic stimulation? Basically It uses short pulses of magnetic field, as the name suggests. So magnetic energy is used to stimulate the nerve cells. So basically repetitive transcranial magnetic stimulation, it produces focal secondary electrical stimulation, which is used to stimulate certain cortical regions which are implicated in certain disorders. So we are stimulating certain cortical regions by magnetic field. So changing magnetic field produces these electrical currents. Now it's a non-convulsive. So ECT we had discussed where convulsion was produced. Here no such convulsion is required or no such seizure is produced, and also no anesthesia is required. As you can see in the image, the person is fully conscious sitting, and it is safe in terms of the side effect profile if you compare it with ECT, and there is no cognitive side effects which may be seen with ECT. So FDA basically has recommended it may be used patients who have failed to achieve satisfactory improvement from antidepressant and antidepressant. So it can be used in depression. Most common adverse effect is that it can cause scalp pain or discomfort. Let's come to the next question. Which of the following theory is not given by the person depicted in the image below? So very famous person and a very famous image. Okay, and the options are A, topographical theory of mind, B, structural theory of mind, C, cognitive development stages, and D, psychosexual stages of development. So who is this famous personality? He is none other than Sigmund Freud. And few points about details about Sigmund Freud. He was born in 1856 in Freiburg in Moravia, now which is in Czech Republic, and he spent most of his life in Vienna, and he subsequently died in London in 1939. Okay, so let us understand. So option A, that is topographical theory of mind, yes, it was given by Freud. He tried to give theories, tried to understand mind. In fact, he is also known as father of psychoanalysis. Now, in the topographical theory of mind, he said that the mind is divided into three parts, that is conscious, pre-conscious, and the unconscious mind. Then he gave another theory which is known as structural theory of mind. Again, he divided the mind into three, which is id, ego, and superego. Freud also gave this theory of psychosexual stages of development. He says that all of us we go through these stages. Okay, and he divided these stages of psychosexual development into five, that is oral, anal, phallic stage, latent, and genital stage. Okay, so these are some of the theories or some of the models which were described by Sigmund Freud. So option C, that is cognitive development stages, has not been described by Freud. So this is the correct answer. In fact, this was given by Jean Piaget, and Jean Piaget described these cognitive development stages, that there are 4 stages of development of the thinking process. So from infancy to the adulthood, we go through these stages in the development of our thinking process. So this was given by Jean Piaget. So the option C is correct. Now let's talk about the next question. A 45-year-old undertook a psychological test. The image shown below is the result of the test performed by him. Which of the following is false statement? Okay, so you have been shown that there is an image which the person has himself drawn, and he performed a test. First we need to identify what test the person might have performed, and then we have to tell which of the following option is false. Okay, so this is basically what, so if you see in the image there, the person is made certain figures. So what is this test? This is Bender Gestalt test or Bender visual motor Gestalt test. So as you can see in the test, there are nine pictures basically, or images, which the person is asked to copy. Okay, so as you can see in the image, so this is the result which the person has given after copying these images. Okay, so this is Bender Gestalt test. So few things we have to highlight, or we have to find out the false statement. So option is it assesses visual and motor coordination. Yes, it assesses visual motor coordination. As you can see the name also, Bender visual motor Gestalt test. It is correct. It is option C, it involves copying of 9 figures. Again, it is correct. It helps in identifying age inappropriate perceptual performance. Yes, so again in age related performance, perceptual performance, this can be also used because we are asking the person to copy certain figures. Now it is not of any use in organic dysfunction. This option is incorrect. In fact, it is used as one of the screening tests for organic disorder. So this is false statement. So it basically, in fact, it assesses various cognitive functions such as memory, sensory and motor functions, language, executive functions, arithmetic, visual spatial function, etc. In fact, it is used as a screening tool for organic brain disorders. So that was the incorrect answer. A patient suffering from psychiatric disorder for 5 years with little improvement is planned to be treated with the procedure shown below. Identify the name of the procedure. So again, this is another procedure which you're asked to identify. Okay, options are RTMS, option B is VNS, option C is ECT, and option D is DBS, deep brain stimulation. So if you see that, on the left side, if you see on the left side of the neck, one of the nerve is identified, and there is an electrode which is put around that nerve. Okay, then there is a pulse generator which is implanted on the chest. Okay, so it gives, there is intermittent stimulation through this generator which stimulates this nerve. So what is this procedure? In fact, this procedure is vagus nerve stimulation. This procedure is vagus nerve stimulation, option B. Now let's try to understand some of these other techniques. So we know in psychiatry, we know one of the pillars of treatment is pharmacotherapy. We use medications, and the other pillar is where we use psychotherapy. Then there are certain other modalities or other techniques which have also been now established, and now also some of them are being used in the treatment of psychiatric disorders. So if we broadly divide, we can classify them as non-invasive. These are less invasive techniques, and the other are invasive procedures. So in the non-invasive procedures like ECT, we have discussed. Okay, again, the person is put under anesthesia, we pass electric current and produces a seizure. And also RTMS. Okay, in RTMS again we have seen that we give magnetic stimulation, and that produces certain currents, electric currents, and we stimulate certain areas. Okay, so these are non-invasive procedure. While then there are invasive procedures. One of the invasive procedures is VNS. Okay, that is vagus nerve stimulation. So what is vagus nerve stimulation? If you see it, so left side of the vagus nerve is identified in the neck, and electrodes are put, and via pulse generator which is implanted on the chest, so intermittent stimulation is given through this vagus nerve. And in this vagus nerve, we know that a lot of fibers are afferent fibers, they're going back to the brain, and a lot of these fibers go to the serotonergic areas. So they stimulate the serotonergic areas of the brain. So one of the conditions wherein it is used is in the long-term adjunctive treatment of chronic or recurrent depression. So again, in depression, we know that there is decrease in serotonin. So we are stimulating the serotonergic areas of the brain, and it is used in adults who have not adequate response to 4 or more antidepressants. So currently, FDA establishes the use of VNS for this one condition. So basically, treatment-resistant depression, we may use vagus nerve stimulation. So this is one of the invasive procedures. So you have to do a surgery type of procedure. Okay, it's an invasive procedure. Another invasive technique is DBS, that is deep brain stimulation. And of course, psychosurgery is again, it's an invasive procedure. Again, sometimes yes, we can also use gamma knives. Okay, nowadays. So again, psychosurgeries may be used for treatment of OCD. So in deep brain stimulation, again, as the name suggests, the deeper areas of the brain are stimulated by implantation of leads into specific areas. Okay, and now again, it is being studied for chronic or intractable depression. Not been approved for this condition, but again, it has been studied. Okay, so this was all from the image-based questions. So again, keep studying, keep revising. Thank you, everyone. May God bless you all.